Once pressure sores occur, they cause significant difficulties in nursing care and are challenging to cure. Therefore, when dealing with pressure sores, the top priority is prevention, followed by care. It has been proven that the vast majority of pressure sores can be prevented in advance. Scientific and meticulous nursing care can minimize the incidence of pressure sores. Preventing pressure sores primarily involves eliminating risk factors. We can start by conducting a comprehensive assessment of the elderly person, then take targeted preventive measures based on the identified issues. The assessment generally includes 1. Assessing whether the elderly person belongs to a high-risk group for developing pressure sores. 2. Assessing what existing risk factors for pressure sores the elderly person has. 3. What is the person's current sustained position, and which areas are prone to pressure sores in this position? First, let's look at high-risk patients for pressure sores, mainly including the following types: patients with neurological diseases, elderly patients, those with edema, etc. Because the physical characteristics, activity patterns, and disease conditions of these groups can lead to prolonged pressure on local tissues, thus easily causing pressure sores. Next is assessing the existing risk factors for pressure sores, including local pressure conditions, mobility, sensory ability, skin condition, etc. Commonly used methods for assessing risk factors involve using scales, such as the Braden scale and the Norton scale. Third is assessing the areas prone to pressure sores in the current position. Pressure sores often occur over bony prominences that are subjected to pressure and lack fat pad protection, are not covered by muscle, or have thin muscle layers. Different positions, lying postures, result in different pressure points and different common sites, so the susceptible areas are related to posture. Looking at these images, when we lie supine, on our back, laterally, on our side, prone, on our stomach, or sit up, the areas prone to pressure sores also change accordingly. Due to factors like functional decline, reduced mobility, and illness, elderly individuals are relatively more likely to be in supine, lateral, or sitting up in bed positions. At these times, we need to conduct skin assessments of the corresponding areas to prevent pressure sores. After conducting a relatively comprehensive assessment of the elderly person, we can implement targeted preventive measures for them. The main preventive measures for pressure sores are: I. Avoid prolonged pressure on local tissues. In daily care, adhere to the 5 frequents. Turn positions frequently. Clean frequently. Massage frequently. Tidy up frequently. And change linen/clothing frequently. For bedridden elderly, encourage and assist them to turn frequently. The frequency of turning should be based on the skin's pressure condition. Generally, turn every 2 hours, or every hour if necessary. When turning, slightly lift the person's body before turning or moving them, avoiding dragging, pulling, or pushing actions to prevent skin abrasions. 2. Protect the patient's skin. 1. Avoid moisture, friction, and irritation from bodily excretions. 2. Change bed linens promptly, keeping them clean, dry, smooth, and wrinkle-free. 3. Use supportive devices like air mattresses, foam pads, and soft pillows appropriately to increase the support surface area and distribute pressure evenly. 3. Promote blood circulation. 1. Carefully inspect the elderly person's skin daily, especially over pressure points. 2. Provide warm water sponge baths as appropriate to promote circulation, but avoid excessive rubbing. 3. Massage the person's back. Use upward, circular motions for 3 to 5 minutes. Avoid excessive massage over existing red marks. 4. Increase nutritional intake. If the elderly person's condition permits, provide a high-protein, high-vitamin, high-calorie diet to stimulate appetite and increase nutritional intake. When pressure sores have already occurred, the nursing strategy is comprehensive care focusing actively on local treatment, supplemented by systemic treatment. Stage I nursing focus. Remove the causative factors to prevent the pressure sore from progressing. Specific measures. 1. Increase turning frequency to avoid excessive local pressure. 2. Keep bedding dry, smooth, and free of debris to avoid friction, moisture, and irritation from excretions. 3. Enhance nutritional intake. Stage 2 nursing focus protect the skin and prevent infection. Specific methods. 1. For small, unbroken blisters, reduce friction to prevent rupture and promote natural absorption. 2. For large blisters, aspirate the fluid with a sterile syringe, disinfect the local skin, and then cover with a sterile dressing. Ultraviolet or infrared light therapy can also be considered. Stage 3 nursing focus. Keep the wound surface clean. Specific measures. Use moist dressings to provide a suitable environment for the wound, promoting epithelialization, such as transparent films, hydrocolloids, or hydrogels. Stage 4 nursing focus. Clean the wound bed, debride necrotic tissue, maintain patency of drainage, and promote granulation tissue growth. Specific measures are as follows. 1. If the wound is infected, irrigate it with sterile normal saline or a 1:5000 furacilin solution. Then pack with sterile petrolatum gauze and a dressing. For deep ulcers with poor drainage, irrigate with a 3% hydrogen peroxide solution to inhibit anaerobic bacteria growth. 2. Perform regular bacterial cultures and drug sensitivity tests on infected wounds, and select treatment drugs based on the results. 3. For large, deep pressure sores extending to the bone, collaborate with doctors to debride necrotic tissue and perform skin grafts to repair the tissue defect. These are the methods for preventing and caring for pressure sores. Thank you.